Type 2 diabetes is a multiple organ disease with a complex underlying pathophysiology requiring a multiple target therapeutic approach. Insulin degludec liraglutide, also known as Xultophy, is a combination of the once-daily long-acting insulin degludec and the once-daily long-acting human GLP-1 analog liraglutide in one pen, developed by Novo Nordisk to capture the complementary mode of action of both monocomponents. This formulation is possible due to the molecular properties of these analogues, which allow the formation of distinct and stable association structures, with the insulin degludec existing as soluble dihexamers and liraglutide as soluble heptamers in the pharmaceutical formulation. Following subcutaneous injection, the additives disperse, triggering the two molecules to undergo very different mechanisms of protraction. Liraglutide retains its heptameric structure, which prolongs absorption from the injection site. In addition, its fatty acid side chain allows for reversible binding to albumin in the bloodstream. The fatty acid side chain and binding to albumin also increase resistance to degradation by DPP4, modifications that significantly prolong the plasma half-life of liraglutide, enabling once-daily administration. In contrast, back at the injection site, a depot forms, with insulin degludec dihexamers assembling into soluble and stable multihexamers that do not interact with liraglutide. From here, individual insulin degludec monomers gradually separate from the ends of the multihexamers and slowly and continuously exit the subcutaneous depot into the circulation, where the monomers are bound strongly but reversibly to albumin. Once absorbed into the circulation, insulin degludec and liraglutide work at different target organs to lower blood glucose in a complementary manner. In the pancreas, liraglutide has effects on both insulin-producing beta cells and glucagon-producing alpha cells. Liraglutide monomers bind to and activate GLP-1 receptors to stimulate glucose-dependent insulin secretion from the beta cells and suppress glucagon secretion from the alpha cells, with the resulting overall effect being lower fasting as well as postprandial glucose levels. In addition, liraglutide has a multitude of actions on many different organs, for example the brain, lowering body weight by reducing overall energy intake, mediated by reduced hunger and increased satiety. In the meantime, at the insulin target tissues such as liver, muscle and fat, insulin degludec monomers bind to and activate insulin receptors. The blood glucose lowering effect of insulin degludec is primarily due to the uptake of glucose following the binding of insulin to receptors on muscle and fat cells and to the simultaneous inhibition of glucose output from the liver. Xultophy offers a once-daily injection treatment that targets multiple underlying pathophysiological defects in type 2 diabetes. The clinical trial program has shown that Xultophy improves glycemic control in patients with type 2 diabetes through the sustained lowering of fasting blood glucose levels and postprandial blood glucose levels after all meals.